Okay, so welcome to the second of monthly webinars we'll be hosting. This one, each one kind of we're trying to keep around the 30-minute marker. So we're trying to make it short and sweet with direct focus on topics that are usually asked and people who call into the lab or ask us in meetings. So we're going to try to address all of these through these webinars, and hopefully you guys find them helpful. A little overview of what we'll be discussing today. Reasons for orthotics, or what goals we're looking to achieve through orthotics. I know these are very general, but we'll be, and there's quite a wide array of different experience out there. We recognize that, but we'll start basic and try to work our way up from there. Common prescriptions, that's something we get a lot of. I know that we can talk for hours on that, but there'll be a sheet that we'll be providing that will be helpful for those maybe just starting off with orthotics and looking to tune up their prescription acumen. Shoe recommendations, that will be something that's going to be quite helpful, I find, for people who prescribe them and maybe get modifications. We'll be talking a little bit about those and how to prevent them. And lastly, I thought we would just quickly highlight insurance documentation. Okay, so reasons for orthotics. Let's just go down the list here. I think we'll start with the fallen arches. That's probably one of the more common foot types, overpronation, that you'll see with your patients. And if you're looking to maybe assess or qualify someone for custom orthotics, that's a pretty good starting point. And visual or pain that they're presenting with, like hallux valgus or bunions and metatarsalgia and heel spurs, plantar fasciitis, all very common reasons that someone may inquire or you may recommend orthotics. Foot pain, of course, if we're looking to remove pressures and stress from certain areas of the foot, orthotics are very effective in doing this. People who, I see personally for my practice, I will see a lot of people who are standing for very long periods of time on their feet. And we usually, I know there's a lot of different footwear one might wear for their profession, but let's say, I'll just take an example of work boots. They're a very rigid shoe, especially in the forefoot. We find that EVA orthotics inside a work boot works really well to provide some cushioning as well between the hard rubber soles and the foot, as well as that added support, and helping reduce foot fatigue through that is usually really well received by the patient, and can make footwear much more comfier to work in if you're on it for long periods of time. Diabetes, again, we're not going to go too much into this, but high-risk patients, if they are presenting with neuropathy or anything, we can help reduce these key pressure points that you identify on the foot. Again, a lot of you have been using the iPad scanners, which is great. Taking photos of the bottom of the feet, drawing attention to certain areas are really helpful for us in helping properly offload or create wells on the device. So good job there. And in regards to any support with shoe wear and calluses, I think we'll focus on that a little bit later on, but you can just examine the bottom of the shoes. I find if they bring in a well-worn pair of shoes, it's a little easier to kind of bring up orthotics and showing where we can help offload it. So you'll see very significant wear medially or laterally on the shoe. If they're very hard on the metatarsal heads, there'll be clear wear on the soles. Or if you remove the insole from the shoe, if it does have a removable insole like running shoes, again, you can kind of see excessive loading patterns, not just from looking at callousing on the bottom of the foot, but footwear will make it that much more obvious for the patient. So I always suggest removing the insole if you can and showing them. And prevention as well. We've been fortunate to hear some pretty good speakers at conferences speak on orthotic prevention and injury prevention, preventing the progression of fallen arches, maybe for patients, pregnancy patients, or patients who currently have bunions, medial tibial stress syndrome, reducing the people who are maybe picking up physical activity. There are a lot of encouraging studies out there showing orthotics as a preventative means as well, which I'd be happy to send you guys. I'll try to include some in the notes of these PowerPoint slides when you download them as well, and sometimes lower back and knee pain as well. So if your patients as well, we wanted to just kind of highlight as well any injury to the lower limbs, a compensated gait, that you can bring up orthotics in these cases for some of your patients. A lot of you would have experience with this and kind of knowing how to properly recommend an orthotic depending on how the patient is walking and compensating. So these are, later seminars will likely go into this a little bit more in depth, but today the purpose of keeping it short, keeping it under hopefully 30 minutes, we're just kind of highlighting some of the reasons here. And the goals, which I feel like go alongside with the reasons, are redistributing pressure equally along the foot, realigning the foot and ankle, of course. I mean, what I mentioned to my own patients is like the feet are your foundation. When you wear an orthotic, our goal is to actually redistribute that pressure more equally along the foot. And of course, like where that attention may be is through, like, I find using the iPad scanner or just using your own phone and snapping a picture of the bottom of the foot. The patient can't always see very clearly on the bottom of their foot, and showing them where that, you don't need like an expensive gate plate to show them where excessive loading is on the foot. Take out the insole, show them the bottom of the shoes, show them the bottom of their foot with a high definition color photo of callousing. They'll already know if they have bad callousing where it is. So this is kind of like the beginning points of where an orthotic serves its purpose. And, we can get into posting at another date and posting up an orthotic to offload, or adding accommodations like metatarsal pads and heel pads. Again, that I feel like is probably more suitable for another webinar, but we through orthotic intervention, we attempt to restore full function of the foot. And that's often done through redistributing the weight more equally along the foot, and especially in those pressure sensitive spots where maybe the patient's already presenting with some localized area of pain on the foot. Of course, injury prevention as well. I'm sure we could go into a lot in regards to like stability in the shoe and footwear, but then I mentioned earlier about reducing foot fatigue. This was a very interesting article. We won't go into it now, but for anybody who treats a lot of runners out there, or people training, this is a really good article on orthotic intervention and the science behind it, and especially definitely for injury prevention and recovery, specifically with your runners. So check it out after the webinar. The slides will be sent out to everybody again. Just a reminder, if you're watching this as a recorded session, there will be the slides accompanied with these videos. So, you can pull them up, and there's lots of notes I've actually added in some of these slides where we've sort of expanded on certain points here. So that will be helpful for anybody who's viewing this after the fact. Go back here. Okay, so one of the more common questions we get are in regards to prescription a lot. There's a lot of great resources online. You don't need to take courses and rely on these webinars for education. I think basically what we did here was put down some of the more common problems, what we look to achieve for, like, for example, at the bottom, plantar fasciitis and relieving load over the inflamed fascia. So there are a lot of different ways we can do this, but generally heel cushioning, arch support. I find that if you're putting heel cushioning, and I guess we can go into this more. I don't want to trail off too much with our accommodations and whatnot, just so we don't take up too much time. But generally, like if you're adding an accommodation or you're wanting us to, maybe if you choose the at lab discretion button on your prescription form, indicating, having the patient point to points of pain and taking a photo of it, and certainly like notating what's going on there, how long the pain's been occurring for, and any other details is very helpful. But if you want to, if you just want to start, this is a good chart to start with, and PES cave. So we'll get a little bit into PES, certain foot types, and prescription today. Offloading certain sites, what to do, what you can add here, and different modifications in the far right column that we look to achieve through accommodations. And again, yeah, you can review this all after this, but I found that a pretty good starting point. One of the things I really did want to focus today on was orthotic modifications and what to do after you've received an orthotic. We've fit our patient, and a few weeks later, some of them come back a lot earlier, the patient is complaining about certain things. So an orthotist always does the modifications. A lot of you have probably been in touch with Joseph, one of our senior pedorthists, about a modification. And I think the purpose of focusing on this is to more or less help people with how to prevent them, and also how to submit an orthotic. If you're getting your first modification, what to do with it. I get a lot of phone calls on like the proper procedure, and we'll go through that right now. So first and foremost, the lab adjustment form, bottom right-hand corner. If you don't have it, I usually send that out with an email alongside of other helpful scanner files when you first sign up with us. But if for some reason you don't have this form, just shoot me a quick email after this. I think everybody has my email by now. It's our adjustment form, which you can fill out the patient's name, circle on the form exactly what's going on. You can even circle on the orthotic exactly too, where these problematic areas are in the orthotic, and any additional notes for the pedorthist who's making the modification. Feel free to always call in too if you find that you're not sure what to do with the modifications. That's why we're here. We're here to help, and give us a call, or we'll be happy to make some recommendations based on patient feedback that you're getting. Another thing we wanted to note was that after you make a modification to an orthotic, it's important that you guys record this somewhere. If you're not, it can be complicated if you reordered, like the patient now is very happy in their orthotics and next year they want to reorder another pair. If you don't have the modification recorded, likely when you reorder it from us, we're going to make that same problem. We're going to make that orthotic with the same exact issue. Maybe if it was like the arches were too aggressive and we had to reduce arch or something. That's why with my own patients, I'll record the modification I made. If you're using the iPad scanner, just simply write it in the patient notes. That's fine. Otherwise, keep it on file for any sort of reorders that you do for those patients. And you won't run into that issue where they get it back and the same problems occurring again from the first unmodified pair that they got with you. Now, after talking with Joe, since he does most of the modifications for our lab, common ones that we're going to list here just are arch pain that the patient will be complaining about. The shoe fit is another one. They put it in the shoe and it's not fitting, which we'll get into in the next slide here on shoe recommendations, so I won't go too far into that right now. The orthotic length is a big one, and that's usually to do with the shoe sizes here. And I'm going to make a few recommendations how you can prevent some of these modifications from occurring. Other times there's just nothing we can do about it. We all sort of have had those patients where it's quite frustrating to work with, and they won't really listen to our instructions or our recommendations. So yeah, this will be kind of right away for arch pain. You can ask for a reduction in the arch. We do, for those of you who have been making many orders with us and fitting your patients, you'll notice we do a full contact orthotic at our lab. And that may not be preferential for everybody, especially maybe some of your first-time orthotic wearers or someone who's been wearing a shell orthotic that's really not full contact along the arch, and they're used to, a centimeter gap there or something. So I do tell people that you can just simply write on the prescription form in the notes section to reduce arch no more than 20%. We'll go into that a little bit later too. The orthotic length, some of you have called us back with orthotics that you're saying are too long for the patient, and they look and appear to be 2 sizes too big. As I was saying, when we do so many orthotics a month for patients, for your patients, we will make an orthotic a little bit longer and extended. If you choose a certain shoe size, or your patient tells you there's a size 8, but in actuality they're maybe a size 7 or size 9, whatever. We have a conversion chart actually that I have a hyperlink, and there's also a link in the PowerPoint slide here to what we go by. So when you write down a 39, or if you read the shoe size and it says a 39, it will likely be a men's size 6.5 to 7, or a women's size 8.5 to 9. You can use this chart. You can use the link. It's helpful when choosing a shoe size, but if we look at a weight-bearing scan and you said it was a size 39, and we noticed that a 39 would only come up to like the tip of the toes, then likely what we will do is make it a size 40 or a 40.5 to fill out the forefoot of the shoe. So it's not the case for everybody, but definitely I know you'll scan the patient and you'll talk about how we are tailoring the orthotic to the shoe. I mentioned this before in the scanning seminar. One of the common misconception is that if you scan the inside of a shoe without removing the insole, if it has no removable insole, that the orthotic can still come back longer. And that's simply because when we take a scan of the shoe, it cannot reach up for the last about centimeter and a half of the toe. So ultimately, we don't know the exact length of the shoe. I always say, pull out the insole. The insoles even curl up. If they're a well-worn insole, they'll curl up a little bit. And you'll notice if you push it flat along the floor, it goes up an extra half size to a size in length. So it can be kind of difficult to determine that exact length of an orthotic. So for that reason, always keep a sharp pair of scissors handy. And it is not uncommon to even recommend, if your patient gets another shoe and it's half size too small or something, that they can trim it themselves in the forefoot, or you can do it there in the fitting. Ways to prevent modifications, some recommendations. Footwear is usually related to that, and we'll go into that in the next slide, but recommending the proper shoes to wear an orthotic in, and ordering the right orthotic for patients with whatever expectations they have, whether or not they want it to be a multi-shoe orthotic that slips into all their other shoes, or do you want just a dress orthotic? We can kind of narrow down what type of orthotic you're ordering. Like, we don't have this like giant catalog of different types of orthotics you need to cycle through. It's all determined on the patient's shoes that they wear, and the expectations we're putting forward to our own patients of what that orthotic's going to fit inside. So and like patients with your very rigid pes cavus patients, they can be somewhat difficult if they're wearing tight-fitting footwear. Generally, I will elect to reduce arch 10 or 20%. if they show me this dress shoes or something, and that high arch will push them out of the shoe or create more pressure inside the shoe. That usually leads to the patient coming back with the orthotic and saying it's not comfortable or it's not fitting. So that could be something that you may want to start considering to do to reduce arch height. Or there's options that you can select a narrower fitting orthotic in the prescription form. That's usually in the options section, the second section of the prescription form. Choosing down at the bottom for a narrow orthotic is helpful. And just talking a little bit about the shoe recommendations, removable insole in terms of, let's see here, we're going to go down, we'll talk about kind of what footwear is best for our patients. A lot of times what they will ask you is, what's the best shoes I should be wearing? If you get those questions, we start by I personally like to recommend something like a stability shoe, Asics, New Balance with like a rocker toe, a proper heel counter, something with a removable insole is always ideal. They often will say, oh, I got to go out and buy a new pair of shoes first before I get my orthotics. But often, if they know generally what type of shoe they want, go out and get it after the fact with your orthotics in hand, and you can see how much room you have in those shoes and see if they have removable insoles to accommodate the orthotic well. That's number one for fitting an orthotic comfy in a shoe, is that it does have a removable insole. Secondly, if they a lot of times they'll show you that Nike, a lot of these popular shoe types now these days are just like very thin fabric and almost like a slipper. So the shoe companies can market them as very lightweight and perceivably comfy, but just horrible for function and working with an orthotic. An orthotic needs to work closely with the shoe in terms of its effectiveness, and it does work with the shoe. Michelle will be the first one to tell you that, with working with shoes all the time, that if they're not wearing proper footwear and they're trying to put an orthotic in like a pair of flats or something, like what expectations are we setting forward to the patient, in terms of how, if they're already presenting with pain, then if I can't get them out of their work shoes, then they need to know that, perhaps the orthotic at that point will be making the shoes a little bit more comfy to wear in, at least, because generally they don't have much. For those that are familiar with the materials we use, which is EVA, ethyl vinyl acetate, that material is also very shock absorbing, a lot more than we find with like polypro shells and carbon shells, whatever. It does add an extra element of comfort to the orthotic that maybe perhaps they weren't getting before with traditionally fabricated polypros and plastics. So I will tell the patient, yeah, okay, well, we may get some results from this, but generally the thinner we have to make an orthotic, the less functional it starts to become. This is not always the case generally. And certainly, like, what we can recommend is that yes, okay, if you insist on wearing these shoes, that EVA will provide a degree of support, but will definitely, for people who are presenting with like plantar fasciitis or heel pain, like, of course, it can act as that buffer on heel strike and those ground reactive forces pressing up on those pressure points. It can hopefully provide some relief, but it's going to always start with us trying to recommend that they wear them in a pair of shoes. Like, if they want to wear them in every shoe, I usually tell them, look, like, your dress shoes, you're not going and going on long walks with them. Generally, again, usually a nice casual or running shoe is a good way to start off with a pair of orthotics, and definitely a good way to bring up a second pair that we can make you a dress pair next time that is more suitable and will feel comfier in a dress shoe. But let's pick the best, most comfiest pair of shoes you wear right now, especially if we're looking to get results through those orthotics. It just depends what the patient wants them for. If they call you and they're not sure, they just know they have coverage for it, and they're not really presenting with a pain at the time, like, that's when we can kind of go into doing baseline orthotic assessments and gait analysis, and again, moving back to the first few slides where I'm talking about identifying callousing on the bottom of the foot and identifying those excessive pressures, where we can start speaking in terms of prevention and and whatnot. So rocker soles, what we mean by that is, it kind of, you can try tapping the shoe at the toe and you'll see it sort of rock, I guess is the best way to explain that. And if they're presenting with like forefoot pain, like those really flat dress shoes, as opposed to, you can see the photo here of the running shoe, how it sort of lips up. That's a nice toe rocker there, and will transition them from flat foot to propulsion and gait easier and help offload. Perhaps if they're presenting with like first MPJ pain or something, then those shoes will definitely help. There is a list of shoes I think I have that I will show you on the next slide that will focus on recommendations, like actual brands that we recommend to patients. And of course, that's always updating all the time as shoe companies release newer. This is it right here. This list will generally update a lot, so it's something we always will need to add and change, but it's good starting points, I guess, if they're looking for their trail runners, cross trainers, they're just a good walking shoe. And some of these are orthopedics, like Atrex. Some of them are like your New Balance 990s, 1340s, 1540s. This is maybe something you can use, and feel free to send that to your patients. And yeah, I mentioned going out and buying a pair of shoes after your orthotics. Another thing is they'll say that they need to go out and buy a pair of shoes, and it just delays the appointment, and we're trying to check in with them. Did you get your shoes? Okay, you can come in for the assessment. No, bring them in for the assessment, talk shoes with them there, and that's the easiest way to get the ball rolling on that. Lastly, we're doing good. We got probably about 5 minutes left. I did want to talk about insurance documentation. This is probably where some of you will leave because you've been doing this a while. But those who are just starting off your orthotic practice maybe, or starting with us, I'm here to help provide any advice on orthotic claims, if you're not sure what you may need, but generally what we need as practitioners is a biomechanical sort of assessment for their insurance claim, a lab manufacturing invoice, which you guys get with every pair of orthotics we ship out. We include our lab's proof of manufacturing invoice, which indicates when the orthotic was made and patient name and clinic name and whatnot. And usually we have to pair that with a prescription from a medical doctor if you're a chiropractor or physiotherapist, orthotist, and lastly, proof of payment is usually required. So some of you may have gotten this form that we've been sort of providing. It's more or less something that a form that the clinic expects you to provide. So I've kind of taken the liberties of putting in everything into one page. So I'm reducing the amount of paperwork that my patients need to submit for orthotics. Like if I split this into like 3 or 4 different pages and they end up submitting like 8 or 9 sheets with their claim, they ensure that whoever's kind of processing the claim can miss it's easier to miss certain details. So this is something, if you don't have it, just again, go ahead and send me an email. Happy to resend it to you. I can send you an editable file. So if you just like certain aspects of this, like the casting technique that you use, or our fabrication process, those are great forms also for maybe sending in a pre-approval to an insurer. Other than that, I probably will stop recording at this point, just so we have a nice even 30 minutes here for those who are reviewing this after the session. And likely the next webinar will be same time in September, and we'll kind of go into new details about different topics that, again, there's a long list of topics we have, but hopefully this was a good starting point for some of you who were just looking for some basic information on orthotics.